I'm intrigued by the modality of complementary treatments, but I know that in the medical profession it's not always accepted. Sometimes the medical profession thinks, oh, it's not so evidence-based, or it's not actually about the treatment, it's just about the placebo effect. But the placebo effect is quite powerful. I mean, it encompasses like trust and communication and somebody to talk to. In your experience, what is the most powerful aspect of giving that complementary treatment?
I actually I think it's really the fact that it's developing that trust, and I find that people will open up and they will tell you things that they possibly wouldn't tell their family or they wouldn't tell their doctor. And I find as well it's having the time. I mean, a lot of the medical profession, I mean, they do really good work, but they haven't got that time. They haven't got enough time to spend with their patients. And I think the traditional idea of the nurse by the bedside is maybe long gone. They're sort of overworked as well. And I think we do fill that gap, that you can give people that time. I think when using the aromatherapy, it's quite a pleasant environment. It's calming, it's relaxing. And I actually feel it's part of the healing process. It's giving people time. And I think it's the touch aspect as well. I think it's just letting people know that they're cared for.
Do any particular complementary treatments lend themselves to cancer care, or would you use any that the patient favours?
I mean, in the time that I've been trained, I remember being trained and I was told that we should never touch cancer patients at all. There was a great fear probably 20 years ago, 15, 20 years ago, that if you actually massaged a cancer patient that you would spread it and cause secondaries. So I know when I was trained, I was very much, it was hands off rather than hands on. And we've found out now that you're not necessarily going to cure cancer, but I think at whatever stage people are on their cancer journey, it can only have benefit. It can relieve anxiety, it can uplift, and it just makes people feel calmer and able to deal with the situation that they're in.
And in terms of practicalities, would you be able to deliver any of the complementary treatments on a ward setting or in the clinic? Would there be a setting that best suited certain modalities?
We're actually able to. I mean, I have actually worked as a volunteer on the Osborne unit. So it was 10 years ago we set up a voluntary. Stop.
Okay, just take a pause and carry on. So you set up something?
I was part of. I mean, I actually didn't set it up. I was one of the volunteers that actually did work on the ward. We offered basic hand massage, and I think we did.
Something we're going to talk about. Okay, so let's put that on then, because I can say that we're trying to get that up and running again. So you worked on the ward.
Yeah, I used to go in on a Friday morning. There was a group of probably about 10 or 12 of us, and we offered. I think there was hand massage, and I think they offered manicures to patients actually in their bed. And we didn't use any, I think we literally just used a carrier oil. We didn't use any essential oils at this point. But again, it was time, it was a time just to sort of help the patient.
How well was that received?
It was really well received, because a lot of, I think the cancer patients on the ward, if they've had a lot of really horrible treatment and they've any dealings with the medical profession, they've just had needles and drips and lines put in. It was actually a time where they could feel like a person again. Really.
You can imagine, from a patient's point of view, every time somebody comes to see them, it's like an aversive experience. They get a drip, a injection, some kind of procedure that they don't particularly want. To have somebody they actually want to see giving them something positive could be restoring a balance in a way.
Yeah, and I think it was. I mean, I actually felt as a volunteer. I mean, I learned a lot about patients, and but yeah, I think they just saw you as, you know, you were a human face and not somebody that was going to do something awful to them.